I'm Dr. Barry Eppley, plastic surgeon of Indianapolis, and I wanted to spend a few minutes with you talking about injectable fillers. This is a very confusing topic for many patients, as there are different types of injectable fillers and there are different characteristics with each of them. They simply are all not the same. And although many patients confuse Botox and injectable fillers, the family of injectable fillers is very confusing in and of itself. For the sake of discussion, the first point I'd like to make is that collagen, which was the only injectable filler that existed from 1981 to 2002, really is primarily no longer used due to its very short duration of action, being around 6 weeks of duration. Today we really have two types of families to consider. One I'm going to call the hyalurons, or the hyaluronic acids, which you know as Restylane and Juvederm, for example. And the other is a totally separate type of injectable fillers and a different family of what I call the particulated fillers, or those fillers with permanent particles in them. These are known today as Radius and Artefill. Let's talk first about the family of hyalurons or hyaluronic acids. Again, most people know this as Juvederm or Restylane. Both of these work well. The hyalurons or the hyaluronic acids are a very natural sugar that exists within our body. There is no need for skin testing, and this is probably the safest and filler that is associated with the least complication of any ones that we know. There's a lot of debate by the manufacturers as to which one is better, but you can certainly expect that the duration of action of the hyalurons is anywhere between 4 to 8 months in duration. Some people will experience longer than that, others will be shorter. Restylane and Juvederm and the other members of this family are certainly the most widely known and the most widely used throughout the United States. The other class of fillers is the particulated fillers, known as either Radius or Artefill. The concept to grasp about these is that there are tiny little permanent particles composed of either plastic or hydroxyapatite crystals or ceramic. Now, these do not make up the majority of what's in a syringe. Generally, the amount of particles is only about 20 to 25%. So while it is true that these particles, once they go in there, do not resorb and are permanent, the vast majority of the injectate, if you will, is a liquid, and that does go away. So over time you may build up a sufficient layer of these particles, but no particulated filler is really permanent with a single injection session. These are usually used around the nasolabial folds and the marionette lines. They are not as good for fine lines because they are thicker in terms of the material that comes out, and they certainly should not be used in the lips. In my practice, I only use Restylane or Juvederm or any of the hyalurons in the lip area, but then I use almost exclusively Radius or Artefill for the marionette lines, nasolabial folds, and sometimes even the vertical 11s in the glabellar area. The nice thing about having so many different types of fillers is that we have options. Not every filler is good for every patient and every single indication that you need it for. It's good to have a family of them to pick and choose based upon the problem. So while many of these injectable fillers are confusing, it is good that we have many of them so your plastic surgeon can pick and choose the right filler for the right problem for your particular needs. Again, they are different. What's composed in each injectable filler is different, and the duration of action is different. No question that the particulated fillers last the longest, probably in the 8 to 12 month range, but again, there is no such thing as we sit here today as a truly permanent filler. I hope this information has been helpful, and I wish you the best of luck on your cosmetic experience.